Good morning, everyone. Welcome to Center of Balance Life. Wherever you are, if it's in the afternoon, good afternoon to you. If it's nighttime, good evening to you all. Under the comment, please show me some love by telling me where you are from, or simply just give me a thumbs up. I'm Kenny, the acupuncturist and Chinese medicine practitioner from Center of Balance. Today, I'm going to talk about how to use acupressure points for arthritis on finger joints. If you are watching this, please give me a thumbs up again, and please like and share this video for those who might benefit from our daily free-for-all acupressure self-treatment. So, do you know any friend or family member who suffer from arthritis in their finger joints? If you do, please type 1. As you know, arthritis is a disease that attacks the tissues of your joint or cartilage. Joints becomes damaged, cartilage decreases slowly, causing the bone to rub against each other. The symptoms can be gradual, with typical signs of pain, stiffness, swelling, deformity, or those small bony nodules, usually on the joint. Weakness, where you may struggle to fully open or close your fingers and become least able to accomplish your everyday task. There are 3 kinds of arthritis in the finger joints, the most common one. Number 1, osteoarthritis, which is also known as the wear and tear or degenerative arthritis. OA causes cartilage to wear away, result in the bone rubbing against each other without protection, causing the usual pain, stiffness, with loss of joint movement over time. Some may even have bony lumps to form in your finger joints. Number 2 is called the rheumatoid arthritis, or the RA, which is an autoimmune disease where your own body immune system attacks its own healthy self. This chronic inflammation may destroy the cartilage at the end of the bone and then wear down the bone. The joint lose their shape and alignment as the tendons and ligaments surrounding the bone weaken and being stretched or even swelled up, causing more pain, stiffness, and loss of functions. This condition often starts in the smaller joint and usually affect the same joint on both sides of the body. Number 3, psoriatic arthritis, which is a form of arthritis that affects your skin, psoriasis, and joints. Your fingers again become swollen, pain with morning stiffness. In many cases, it is similar to RA, which is the number 2. However, it may involve several fingers. Not all patients with arthritis will experience the same symptoms. The severities can vary greatly from one patient to another patient. With proper treatment, many are able to manage their symptoms and stay active. Let's see how well you respond to our acupressure point that I'm about to demonstrate. As usual, do you have any of these tools? 1, it's a good old knuckle. Okay, with your knuckle, your index finger, make sure you bend down, and with the thumb supporting it at the bottom. Okay, if you do it like this, can be a bit sore though, so make sure you have your thumb supporting it. Okay, number 2, some small rounded tool, which I usually use, my good old chopsticks. And then number 3, the massage device. Okay, any of the 3 can be used to locate the sensitive points apply pressure for 15 to 30 seconds, and then you move on to the next sensitive points. You repeat that 3 to 5 times. You can do it throughout the day. If it's too painful, I would advise you to do it the acupressure every hour. If you have been watching our daily acupressure videos, we always advise you to use the opposite side to treat your painful side. But this time it's different, okay? We are going to use the same, which is your painful side, to treat. Yes, you will be using your healthy side to massage your painful side. Of course, if your pain's on both sides, please ask your lovely partner or your kids or your friend to massage for you. Okay, let's say your finger pain. Okay, your finger pain is on the left side. Okay, we are going to palpate on your painful side, which is the left side. So right side is my healthy side. So I'm going to use my good old chopsticks because it's get rounded and it's quite long. I can show you where it is. It's easier for me to do. Okay, we're going to palpate the left side between the metacarpal bone. Okay, between the bone. Don't rub on the finger joints. Okay, yes, your pain's on the finger joint, but we're going to use this area to treat your finger joint. Okay, again, that's on the painful side. Okay, so please make sure you rub between the bone. Okay, between the bone, that's where you will be applying pressure. Okay. I like to start from the pinky side. Okay, so between the fourth and the fifth metacarpal bone, you palpate for sensitive points. Okay, this is a bit sensitive. Give a 30-second rub, or you just apply pressure there for 30 seconds. Okay, and then you move on to the next one. You keep going. So you start from the top, you work your way down to the base. Okay, you can repeat this 3 times on the same area. Then after you finish 3 times, you move on to the next one, which is between your 3rd and 4th metacarpal bone. Again, you palpate for the most sensitive points. Once you find one, you give it a rub for 30 seconds before you move on to the next one. Okay, again, you start from the head, you work your way down to the base. Okay, you keep going. You repeat for 3 times. Then you move on to the next one, which is between your 2nd and 3rd metacarpal bone. Okay, you start from the head, you work your way down to the base. We palpate for the most sensitive points, and you leave it there for 30 seconds. Okay, you move on to the next one. Then you repeat it for 3 times. Okay, then you move on to your index finger. Okay, this time it's your index finger. Okay, you palpate for the most sensitive points along here. Okay, you start from the head, you work your way down to there. Okay, find the sensitive points, you hit it, hold for 30 seconds before you move on to the next one. You repeat 3 times again. Okay, now the next one is on your thumb. Okay, on your thumb side, if it's quite painful on your thumb too. Okay. You see this bulging bit here? Yep, this is where we will be palpating. Okay, so you find the bone, it's just between the bone and the muscle. You palpate. You find the most sensitive points, usually at the base of the thumb. Can be quite tender or quite sore. Okay, so you give that a rub for 30 seconds. You keep repeating it on the same side for 3 times. So after you finish all those points 3 to 5 times, please place a heat pack either on your hand, or you can wrap around for about 5 minutes or longer if you like. Of course, please don't burn yourself. Why are we doing this? Why are we doing acupressure and apply heat pack? Because we aim to get more circulation to your joints, because that's where your arthritis or your pain is or your stiffness is. Okay? Please do them a few times a day, every day. If it's more severe, more often. Don't worry if these tips not giving you much relief. We are here for you. We care about you, and we love to help you. Please call us as soon as possible or email us info@balancetcn.co.nz to book an appointment. We have 3 clinics in 3 different places: Hamilton, Raglan and Auckland. My name is Kenny. That's all from today. Please like and share this short live lesson with anyone you know that may be beneficial from it. Thank you for joining us. Looking forward to seeing you guys all again. Stay awesome. Thank you.